channel. So today we're going to go through how to break bad news. So this is some practical stuff. So this is an essential skill for all skills and clinical practice, especially with the introduction of lex, and for those who do USMLE also as well. And also from an early stage, doctors find themselves in situations where they need to convey difficult news to patients and or relatives of the patients. Bad or distressing news is never easy to hear, but having someone deliver the news well can make the person receiving it feel respected and supported going forwards. They trust and respect where the data is coming from. So here are some general tips. So you have to prepare for the consultation by choosing an appropriate environment and performing sufficient background reading to ensure you have a good understanding of the patient's situation. So you have to go through your patient's information, patient's documents, so that you actually get a good understanding of the patient's situation and details. So introductions. So first thing first. So if there's need to sanitize your hands, sanitize, wash your hands, introduce yourself, including your full name and your actual role. So you also have to check if you have the correct patient and also the correct information, and you also can also confirm if they are happy to be called by their name. Like you can just ask them if you can call them by their name, their actual name, first name to be specific, or maybe their husband's name, yeah, like Mrs. or something. So explain the purpose of the interview. For example, I have been asked to speak to you about some recent investigations you have had. So you've heard the example. So it's telling the person that actually you have been told to do something. You have also mentioned to say there's some investigation that she has had. So the patient is now connecting. So let's move. So if you are seeing the patient instead of their usual doctor, you have to apologize for the change and explain that you are stepping in for whatever reason. So you have to make sure the person you are seeing trusts you, and also you have to gain consent to discuss the topic with the patient, and explain that the discussion will be confidential. So first things first, you active listening. So active listening, you have to display active listening throughout the consultation. So how do you do that? So you have to maintain an appropriate level of eye contact throughout. You should be open, relaxed, yet professional body language. For example, uncrossed legs and arms, leaning slightly forward the chair. Also, you have to nod to acknowledge what the patient is saying where appropriate. You also have to avoid interrupting the patient throughout the consultation. So make sure you are not interrupting the patient because you are breaking bad news. So you have to make sure the patient is able to communicate to you freely. And last part on the general tips is you have to establish rapport with the patient. So try to establish a rapport with your patient and ask how they are. Offer them a seat if they didn't find them sitting, or if maybe they were standing. But in an OSC station, of course, maybe sometimes find the patient is already standing. Yeah, probably it also in a practical. So tend to be either standing or sitting. So if they are already sitting, of course, we have to move on. And if you are in a consultation room, you offer them a seat, a glass of water, and also you have to emphasize with any emotion they display, verbalize or they verbalize some emotion, and also acknowledge the difficulty or stress of situations they could be experiencing. So I have to watch them carefully, and also have to listen and respond to the things the patient says. This is the last part for general tips. Then structuring the consultation. So how do you do that? So there's a mnemonic for that. Spikes, though it may be hard for you to remember in a practical setup. So spikes is the mnemonic. So SPIKES, spikes, which is an effective way to structure a consultation. So S is for setting. It's important to break bad news in an appropriate setting. The The discussion should occur in a comfortable, quiet, and private room, although this is not always possible. And you have to make sure you have at least some privacy and that the patient and family have somewhere to sit. So bad news should never be broken standing in a corridor. So as I'm sure some of you have done before, so make sure you don't do that after learning this. So you have to make sure to have some tissues available or something, especially tissues for the patient to use. So ensure both you and the patient or relative are sitting down. You have to arrange the chairs if necessary. For example, maybe you have to sit across each other, let's say at 45 degrees angle to each other. Also avoid any physical barriers between you and the patient. So e.g., for example, a desk. You also have to ensure you have uninterrupted time during the meeting, and also turn off any beepers and phones. So make sure if it's your phones, maybe if you are very busy, maybe just put them on silent, because you'll be talking to a patient who is about to receive very bad news in their for, probably the most bad news they have received for in their lives. So other people who may be helpful to have in the room when breaking bad news. So we have other healthcare workers who can provide support in breaking the diagnosis. For example, a nurse specialist, maybe a probably maybe if you needed a colleague, you can maybe a colleague can be there also. Yeah. So ask the patient if they want anyone to be with them. Like, would you prefer to have a family member or friend here? Likewise, if there is someone else already in the room, check to see if your patient would prefer to be told alone. So confidentiality and privacy are key. Then the following letter is P, which is for perception. You so have to begin by discussing the sequence of events. So reading up to this point. So you have to, if you have been given scans or biopsies or X-rays, you have to begin from there. You more like you run through the sequence of events and assess the patient's current emotional state. So ask about any symptoms the patient may have been experiencing up to. Here you could agree with the patient and say something like, yes, the reason we wanted to do the test, so we could find out why you have been experiencing the symptoms you just described to me. Were you aware of what sort of things the investigations might show? That's the question for the patient. So it's like you were trying to find out their knowledge. So establish what the patient already knows and is expecting. So the patient may or may not have been made aware of the possible diagnosis. If they don't know of the possible diagnosis, you could say something like symptoms like the ones you've been describing can sometimes be as a result of an infection, but sometimes they can be as a result of a more serious underlying condition or conditions. So this can also act as a warning shot. So we are trying to prepare the patient mentally. So that's for the P. Then the I is invitation. So we have to check if the patients want to receive their results today. So in an OSC station or in a practical exam setup, the answer will always be yes, because I mean you have been given to break bad news to a patient and or to a person, and the examiner will be there just looking at you. So you of course you want to ask the person that you want to receive the news today. So yeah, so the answer here is the yes. So the patient they are going to receive the news that same day. So however, on the wards or in OPD, be aware that some patients may recognize the news and may not want to be what they hope for, and may want to put it off until family are present. So you can just begin like, I have the results here today. Would you like me to explain it to you now? So you give the patient chance to tell you what they want. So we are done with the I. So next is the K, which is for knowledge. So ensure you deliver the information in sizable chunks and regularly check the patient's understanding. So use a warning shot to indicate that you have unfortunate news. For example, Maybe you can say like, as you know, we took a biopsy, or you did a scan, or you took an X-ray, or maybe something, the investigation that you did, or if it's an analysis station or a practical exam, the investigation that you have been given, they told you they did to confirm the diagnosis, and you have to go like, as you know, we took a biopsy, and unfortunately, the results were not as we hoped for. That's more like a first chunk of the information you have given her. So allow a large pause if necessary, so the patient is able to digest what you have told them, and then provide the diagnosis using simple language. And again, let me give an example. So you can go like, I'm sorry to tell you this, but the results from the investigation shows show you shows that you have cancer. So if maybe you have been given a station where the patient has a lung cancer, so you can actually even tell them like, I'm sorry to tell you that I'm sorry to tell you this, but the results from the investigation which we did show you that you have a lung cancer specifically. You can tell them what kind it is. So you have to deliver information in chunks, pausing between each piece of information, because this is big news, very bad news to the patient. So after giving the diagnosis, it's wise to wait for the patient to reinitiate the conversation. So you don't have to continue giving the patient data, even go to the how to manage. So you have to give the patient time to getting the data, to understand what you have told them, and also wait for them to reinitiate the conversation. So another example, yeah, we have a lot of examples today. So another example is, I'm afraid it's not the news we were hoping for, Mrs. Charles. Yeah, makes sense, Mrs. Charles. So I'm afraid it's not the news we were hoping for. Then you pause, even take a breather. Then again go ahead and say, unfortunately, the is due to a more serious underlying cause. You pause again. So I'm so sorry to tell you, but you have lung cancer. You have to pause again until the patient speaks or seems ready to talk again, like I said earlier. So make sure your tone is respectful, at a slow pace and clear. It is very natural for the patient to have an emotional reaction at this stage, or they may go quiet and ask questions in disbelief, deny that this is happening, or they might even start crying, or become hysterical, angry, or even shout at you, or maybe call you names and the like. So these are all normal reactions to hearing bad news, and each person will respond in their own way. Remember, we are humans, so we don't necessarily follow the same way of showing emotions. So you have to give the patient time to have their emotional reaction. People often find it very uncomfortable watching patients like this, but it is important to give the patient space to react. So maybe after giving the diagnosis and the like, the patient might ask you questions in disbelief, such as, this can't be happening, can it? Or, but how am I supposed to deal with this? More like they have given you now. So I often these are some of the things which I often ask at this stage after I've given them the diagnosis. So make a judgment about whether you need to answer the questions directly, saying something like, I'm so sorry today, uh like, you apologize, and might be all you need to say at this point. If they are making eye contact with you and asking questions like, so what will happen next, then it is probable that they are ready to receive answers to their questions. So if it's an ask station, you have been given even like the actual diagnosis, and they have been told to tell her the treatment modality. That's when, now after you have to get told her the diagnosis and the like, that's when you can even like she tell you what's the way forward. That's when they, okay, so we have treatment modalities for this and this and this. Yeah. Or she might maybe ask you if it's like, so am I going to die though? Yeah, like these kind of questions are going to come. So we were on K for knowledge, so we are done with K. We go to emotions and pathway. So that's E. So you have to recognize and respond to emotions with acceptance, empathy, and concern. So on empathy, you have to empathize with the patient and you have to show concern. So I have to acknowledge and reflect their emotions and body language. Do not lie when the patient asks about the prognosis. So like I said, the patient might just ask you like, so am I going to die? Because that's what they get when they hear cancer. So it's like, am I going to die? If you do not know information, so if it's an auscultation, you haven't read about the condition you have been given, don't lie. So then that exam for you will be, it will be, that practical exam will be hard because don't know the prognosis of the disease. So what do you tell her? Are you going to tell her that she's going to die, or are you going to tell him that they are going to survive when in actual sense the disease has progressed to a stage where they have 2 months to live? So make sure you have more knowledge on things. And so after that, if you don't know information, tell them that and suggest that you can refer their case to a specialist or that more information is needed. You get it. You be honest with the patient. So I'm so sorry at this stage. This is an example. You can like what you can tell her if you did not know what the prognosis is. So you can just say, I'm so sorry, but at this stage, I don't have enough information to answer that. Hopefully, in the next few weeks, once we've completed the other test, I can be clearer. And again, you apologize, say, sorry, I can appreciate that it's frustrating to be left with unanswered questions. You are you are showing empathy, you are showing acceptance. So you can also use some other useful phrases, which include, I can see this is a huge shock for you. This is one of them. The another one you can say, I can see that this is not the news that you expected. I'm so sorry. So that's the end for E, which is emotions and pathway. So the last S, which is strategy and summary. So you have to make a plan together to meet the patient again, more like for reviews and the like. So and you have to inform them of what the next steps are. So if the treatment modalities, what are you going to be doing with the patient in the coming weeks? So you have to reassure the patient that they are going to be referred to the appropriate team of specialists and try not to rush the patient to make decisions about their treatment if possible. It is respectful and considerate to let them process what has been told of them or what has been told to them. Check the patient's understanding of the bad news you have delivered. You can ask her like to see if she has actually understood. Like you said, you have to make sure you haven't bombarded the patient in medical terminologies. The patient does not even understand what the cancer is. So you have to make sure you check the patient's understanding. Then finally, you have to summarize, like respectfully and gently. Repeat any important points. So patients who are shocked or upset will not take in much information. So that's why summarizing is important. So ensure to answer any questions or concerns that can be addressed at this point of stage, and have to listen out for any implicit ones. So yeah. So have to also offer ongoing assistance to the patient. Should they think of any further questions, so have to tell them that in case of any other question, you can come or you can ask again. So this may involve giving them details of a clinical nurse specialist. You don't necessarily have to give them your line and they like, because they will be troubling you. Yeah, but if you want, you can do that as well. But there should be some standard, some way of dealing with things. So for maybe this case, maybe there is a clinical nurse specialist who deals with assistance. If the patient wants to talk to you, we can take you through the clinical nurse specialist. Also, you also have to offer assistance to tell others. So other family members, like the bad news. So you have to offer assistance. So let's say maybe the patient asks you to say, what am I going to tell the family? So you can say, maybe you can maybe tell the patient to tell them, but a more nice way is for you to offer assistance to tell others. Say, actually, you can come with them, then you do the same setup and the like. Then you tell them, say, uh, uh, do you know why she called you? You ask them again. More like you just go through the same things we did with the patient. You tell them now the family members or the relatives or family members, like I said, the same bad news, the same way we did. So you have to highlight where the patient can go to gather more information or gather in support groups, websites. Also offer written materials if relevant and available on the same diagnosis and treatment modalities, or any written materials you want to give her. And also, if appropriate, you have to consider asking about the religious preferences or whether the patient would like uh, the chaplain. You get, yeah. So make sure you know what you are dealing with. Then after the consultation, as in after you are done now with the breaking bad news part, you have to close the meeting now. So you, of course, if maybe you did you suggest you sanitize your hand, you have to again, wash your hands again. And also make sure you are aware that breaking bad news can be emotionally challenging for you as well as a healthcare professional, and particularly if you have built a rapport with the patient. Because imagine you have been dealing with the same patient, and let's say a husband and a wife, and the husband dies, and maybe you had a good relationship with the wife, so it would be very hard for you even just to do that. So be aware of this, and this is real otherwise. So you have to think through your own emotions, your own thoughts, and reflect on how you are feeling, and take time out if needed. So this is the last part for the structuring the consultation. So here are some closing general points. So breaking bad news is not only done in the context of cancer. So there are a wide variety of possible situations in which the strategies discussed can be applied to. So for example, you can use them in sexually transmitted infection results, diagnosis of type 1 diabetes, miscarriages. So you have to think about how a patient might feel when giving them any information about their condition and how it may impact their lives. So make sure you also use the correct language. Cancer is cancer, death is death. Remember, miscarriage is miscarriage, and it is important that there is no ambiguity about what the results shows. So just tell what your investigations have found, and also avoid using big medical terminologies or euphemisms and medical jargons otherwise, because the patient might not actually fully understand you, or they might get the wrong idea about their condition.